Now, with Ontario's bumped up capacity limits now in effect, that means 30,000 fans will be able to cheer on the Blue Jays at tomorrow's game. But are experts cheering on that decision to increase caps when it comes to venues? We say good morning to Colin Furness, an infection control epidemiologist and assistant professor at the Faculty of Information with the University of Toronto, longest title of all time. Good morning to you, Colin.
Good morning. Thank you.
All right. Thanks for joining. Before we get to the capacity limits, I want to start with our report from Faiza Amin. She was showing the anti-vaccine protests and then some people actually arrested. Unfortunately, this will not be the end to this. I want to get your take on whether or not the vaccine certificate program, as it stands in its current place, is effective and whether or not that puts some people in danger of enforcement.
The idea is really important to have a vaccine certificate. But to do it, it needs to be implemented properly. And in Ontario, that's not happened. And that's going to put a lot of strain, a lot of onus, a lot of difficulty in place for business owners who are now left having to deal with PDF documents that can be easily forged. There isn't a tamper-proof or robust way to make this happen. So the idea is great, but I think the implementation is terrible. And I think it's going to be very difficult for business owners.
Yeah, indeed, at least until we get to October 22nd, when we see that QR code, which at least is a bit more specific. Now let's get to capacity limits. We heard a lot of people cheering on the Blue Jays, people attending the Leafs game, with capacity limits increasing to that 50% in major venues. Do you feel, as an epidemiologist, it is safe and everyone is okay in attendance?
We're going to have to see whether it's safe, and we'll see it in the infection numbers. The question is this: what are you accomplishing by doing this? On one hand, we're getting back to normal life. On one hand, we're going to encourage more people to get vaccinated when they can see that this is something they can go and do. And that's really positive. Whether we're ready for numbers that big and how many people forge their vaccine credentials in order to get into the building, those are questions we can't answer yet. So we're going to have to see. I'm not thrilled about the large number, but I totally get what it's trying to accomplish. So again, if we can do it in a way where we absolutely sure that everyone is vaccinated, that no one's lying, then it really ought to be okay. The problem is we can't.
That is an issue, of course. Dr. Davila with Toronto Public Health looking to head to the government and say, let's make vaccines, the COVID-19 vaccine, mandatory among the list of those that are already mandatory for those who attend school 12 and above. Do you support that?
I do. Categorically, I do. There's no question. The vast majority of kids in schools are vaccinated, but everyone's at risk by those who aren't. I include students in that, and I also include teachers. If teachers don't want to be vaccinated, they could be assigned to doing virtual teaching or something else. Kids who don't want to be vaccinated can learn at home. Over the age of 12, kids can consent for themselves. So it does give them some agency to be able to say, yes, I want to be in on this, or no, I don't want to attend school. I think that's exactly what we should do.
All right, Dr. Colin Furness, we have run out of time, but we could talk for days. I appreciate you taking the time for us today. Thank you.
My pleasure. Thanks.